Today I have the distinct honor to introduce the President and CEO of Breathe California of Los Angeles County, otherwise known as Breathe LA, and the Emphysema Foundation of America. Please join me in welcoming Mark Carroll.
Good morning. We are here for the 11th, well, we're together for the 11th year in a row, and we're here for our third year, so we're very excited that all of you are here to join us. We have a wonderful program for you today, and I just want to go in and tell you a little bit about what Breathe LA and the Emphysema Foundation are doing in this coming year. We're going to be working in Sacramento on legislation to address COPD. Currently in the California Health Code, there are provisions regarding research, treatment, and reimbursement levels for a whole host of chronic diseases, and COP is listed, but under the title Chronic Obstructive Pulmonary Disease, there is nothing in the law. It's an empty slate. So we plan on putting some legislation together so that we can try to get research funds and more funding for awareness and treatment and increased diagnosis of this disease. I want to thank all of you, and I appreciate you coming, and I'm excited about what we're working on in the future, and please come up to me and we can talk more about any of these and more. Thank you very much for joining us today.
So I'd like to welcome the moderator of today's COPD conference, Dr. Guy Su.
Let's talk about COPD. So this is the GO guidelines from GO. I think many of you already know that smoking and air pollution main cause of COPD, 85% plus. There is lung injury, decline, hits smaller waves, causes emphysema. Manifests as both airflow limitation and systemic symptoms. I think part of what GO and the community really wants to emphasize that it's a common condition, it's preventable, but it's treatable. I think that in the past, treatable has not been in part of the conversation about COPD. And a lot of what we can do can be ameliorated by things that we try to prevent and manage. And there is a COPD action plan. This action plan has been in place for 4 years, but just to highlight, still, you've heard this, third leading cause of death, fourth leading cause of disability, doubling of the death rate, costs a lot of money, $50 billion soon, and that's just next year, 2020. It remains unabated. 80% are due to smoking, and but I think most of it, the emphasis is that a lot of this can be preventable.
Now, smoking cessation, should we develop a medicinal vaping device with known components and with good quality control, known dosing, and perhaps don't use vape, use a nebulizer. And so you don't have the heating of the chemicals that cause a lot of these toxic chemicals to occur. Well, the impact on society so far with adults and kids, maybe in England and a few other places where they do favor e-cigarettes, there are less people smoking, but there are a lot of dual users. So basically, we're creating a new generation, especially for kids, of nicotine addicts who smoke, they vape, and they do dual use.
20 to 40% of patients with lung cancer have COPD. So the genetic profile that makes a smoker susceptible to developing COPD also makes that smoker susceptible to developing lung cancer.
So the message here is, if you want sort of a new generation approach to rehabilitation, you might do the following. You might try to optimize exercise tolerance gains, because if you don't improve exercise tolerance, that's sort of the baseline for improving physical activity. Optimize lung function, of course. Formal behavior modification seems to be a good thing. And then these telecoaching and pedometer feedback options seem good. Not in isolation, but on top of rehabilitation.
So you guys have seen the news. We have this e-cigarette or vaping product-associated lung injury epidemic. I'm going to refer to that as E-Valley from now on. We've hit 1,888 cases. It's in every single state in our nation except for Alaska, along with some cases in the Virgin Islands, Canada, and England. And this map shows where the deaths have occurred. So we're up to a death toll of 37 and counting. So why is this hitting the lungs? Why is this new disease happening? So on the far left, this is the CDC's visualization of the damage happening in the lungs, so sort of the fire in the lungs. And what it looks like is an inhalation toxic inhalation injury, which is really killing numerous cells all at once and leading to massive inflammation. So overall, e-cigarettes are definitely going to have health consequences. The E-Valley thing is just one signal of a subacute disease that's going to happen, but we're just going to see more and more and more. E-cigarettes are here to stay, whether they're banned or not. People are going to use them, so we need to keep studying these devices and liquids, and just keep in mind that genetic susceptibility is going to play a role. See you later.